Welcome. Come with me. The doctors will see you now.
Welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Veer. Today we have with us Dr. Mary Clarke, a dedicated physician at Stillwater Medical Physicians Clinic. Dr. Clarke's medical journey began here in Oklahoma. She earned her medical degree at the University of Oklahoma College of Medicine and completed her residency at the Medical College of Wisconsin. She's been a strong advocate for public health, especially during the COVID-19 pandemic, where her leadership as the president of the OSMA was pivotal. Dr. Clarke's commitment to health and education earned her the prestigious 2022 Friend of Education Award from the Oklahoma Education Association. We are hoping to learn more from her, about her, and what the OSMA is. Today, Dr. Clarke, thank you so much for joining us.
Absolutely. Happy to be here.
So, Dr. Clarke, for those in our audience who may not be familiar with the acronym OSMA, what does that stand for?
OSMA is the Oklahoma State Medical Association. This is the group of physicians who come together with support for the association. We pay dues, and we are the group that works. Our goal is to make healthier patients in Oklahoma. We do this by as much advocacy as we can. We work as a coalition of all physicians, so across all specialties. We all belong to our specialty societies like Family Physician, Oklahoma Academy of Family Physicians, but the State Medical Association is that group that encompasses everything. Mm-hmm. So we're very eclectic, and we try and work with all stakeholders to make things better for everyone. And remember, it's better for all patients. We, as physicians, are also patients.
Yes.
So what we do is not just trying to make physicians' salaries better, or we work less, or we make more, or it's easier job, because that's never going to happen. Our job is difficult, and it's stressful, and that's why we love it. But we want to have good long-term care physicians in our state, because we're still patients, and at some point, we're probably going to have a health issue, and we're going to need those people too. So making better advocacy for Oklahomans and all Oklahoma care is really our goal.
Excellent. So thank you for that description. Now, when I entered practice in the late 90s, and then my perspective even into the early 2000s, not that this was an accurate perspective, but it was my perspective nonetheless related to the AMA, is that the AMA seemed to me to be much more subspecialty surgical specialty focused than really having much of an effort or advocacy related to primary care. And at that point in time, I honestly wasn't paying that much attention to the Oklahoma State Medical Association as to what they might have been doing or where their advocacy was directed. So tell me, what prompted you to decide to pursue leadership within the OSMA to get to the point where you served as the president of the OSMA? So take us back before that. What drew you to the OSMA as an advocacy tool, as an advocacy agency?
Through my career, when I graduated and my original job was in Wisconsin, I finished my degree up in Wisconsin. I worked for UW-Madison, UW Health, and I was an academic educator and worked in the family physicians. And at that point in time, we were pretty close in advocacy. Our group in and around the Madison area did a lot on a monthly basis. We had meetings. There were a lot of the physicians in town that actually came together in these groups, and then as the state association. And then I moved to Texas, stayed involved, was involved a little bit more with the Texas Family Med Association. And then when I moved here, then some of my partners were also very on the board of the association here.
Okay.
And they linked me in, and I became a alternate trustee in a rural state at large, and multiple different phases until at one point that it was my turn to rotate into the presidency position.
Okay. You may not know this, but how many times has a family doc been at that leadership position as president of the OSMA?
We looked into that. As far as we know, we could not find another one besides myself.
Wow. Well, congratulations on that. Outstanding.
That is.
Now that doesn't mean that's not the case.
Right.
I mean,
Right.
we don't have data going back 100 and whatever years.
Right.
We've been around 120 something.
Wow.
But as far as we could find in the recent history, there was not another family physician.
Excellent.
Yeah, I really like the events that OSMA puts out, or the effort to really improve, getting physicians involved in aspects outside of clinical care, like the OSMA Physician Leadership Program. I was a graduate of that 2 years ago and really loved it. And I think the OSMA does a really good job on trying to get physicians together to kind of talk about these things as, hey, we're patients too, and we need to be looking forward to the future and the overall health of Oklahoma.
Right.
And during your time as president, Dr. Clarke, you had gone. It was the COVID-19 era, right? And challenging time to be in. Do you remember, like, what was your experience like that back then? And I know there were several bills that you were advocating for. I think one we ran across was the Senate Bill 658 that came up and when we were researching what you had done. Do you remember what that bill was about, or could you tell us your experience during the COVID-19 pandemic?
Was that the one with the childhood and the masking in schools and that?
Yep.
Okay. Yeah. So this is kind of interesting, and not to say any names, but the OSMA became aware of the anti-mask sentiment in schools especially. Right. And we were trying to keep as much real information with people through our legislators and trying to keep the false rhetoric down as much as possible. And when that really didn't work, then there were a group of families who decided that they were going to work about supporting their children. And so there was there was actually a lawsuit that came out and around that time with, I want to say it was 6 families, and this is a while ago.
Yeah.
There were some families that came together, and we wanted to support that. And so part of this anti-masking sentiment with these bills, we were trying to block a lot of the rhetoric that was false.
Right.
Wearing a mask does not harm your health.
Right.
Period. It does not increase your CO2 levels to any significant extent. You're not breathing in bacteria any more than you normally would. All of these kind of false things that came in. And so it became very divisive, right?
Yeah.
Against political lines, which was the unfortunate thing. And so we were really trying to keep those bills out of making decisions that were not based in science.
Yeah.
And that partly was a little bit of the culmination of anti-science at the time, anti-vaccine rhetoric at the time, and then that coalesced with the anti-COVID movement, and it became very, very large. So we just worked as hard as we can, lobbied against some of these really bad bills. We had anti-vaccine bills and they have continued to come through. We killed a bunch this session.
Right.
So far, we've killed all of them, and hopefully we will continue.
Yes.
But I know we all like, what? So there were a few bills that we just tried to get passed, and if some bills, and most of the bills, the anti-science bills, most of them we were able to kill through that time. But it was an interesting time. I would have never guessed that I would be in that situation.
Yeah.
Thank
you for your leadership during that time, by the way. And it was great. I was moving back from residency and coming back to Oklahoma, and there was just a lot of. You think there's similarities between then and now? There's a lot of misinformation out there, and kind of some of the same problems. Another virus that spikes, another vaccine that's bad for you, and then that when there's just so much misinformation out there, it kind of dwindles public trust in our training or the science behind it, and it's sometimes hard to really fathom.
Yeah, it is. I know it's frustrating to see non-medical people, and then especially when it rises to the level of the legislature, using pseudoscience and false science to justify actions that don't really make sense. But I also personally feel that the House of Medicine harmed ourselves early in COVID, that there were entities the CDC was referencing and a lot of other people were referencing that had models that said 24 to 30 million people are going to die in the United States. And then nobody ever said, you know what, we really screwed up, and here's why we screwed up, and here's why we think our new models are better. It was really just, they just changed the narrative and kept going and never acknowledged that they were wrong before. And I think that contributed to a lot of the disrespect for the medical community and doubt for some of the science. What do you think is the takeaway from that pandemic? Not so much that we'll do everything right in the next pandemic, but what are some of the broader lessons that we need to be aware of as physicians approaching that kind of thing moving forward if we encounter it again?
Great question. It's all, I think, about communication. Mm-hmm. Two things happened. One was the information that we got from CDC and things that turned out to be incorrect, mm-hmm. right? But a lot of things that we had initially turned out to be correct. Yeah. And we forgot about those. Mm-hmm. Right? I mean, but we're all kind of a little guilty of paying attention to the negatives instead of the positives, yes. and that's what we hinge on. The other thing, and then they didn't, come back and say, well, our new model is this. We learned this. Right. But when you have a generation or two who are not really being taught science and the scientific method, then you get distrust because I'm changing the story on you. Mm-hmm. You told me one thing yesterday, now you're telling me something today. Absolutely. That's the scientific method. Yeah. Yeah. And most people don't really see that. And as I chatted with my patients through all of this, I tried to help them understand, you're right, I'm going to tell you something today that I may change 180 degrees in 5 years. Right. I don't know that because we're all learning. And COVID gave us a global, immediate, scientific effort on something that was completely new, where we have had 60 or 70 years where we've worked out diabetic complications and hypertension complications and coronary artery disease, and people just know that that's what we do. But they don't remember, or were not around or not alive to see all the things that we used to do that we would never do today. Right. And understand that that's really what it is. We had a scientific method experiment for a global pandemic that was immediate and worldwide. Yeah. The perfect scientific experiment. Unfortunately, it cost a lot of people's lives. The other thing that was a long answer to that first question. The other thing is how we got caught. I really don't think any of us would have ever thought that people would not trust us.
Yeah, right.
So we got caught sitting on our hands, making an assumption that is such a stupid thing to say. No one's going to believe that. So we didn't really think that was going to happen until that became an ingrained information in our social media, that now all of a sudden we were playing whack-a-mole. Yeah. And we had people who were, selling books and vitamins, just read my book and how do we cure COVID and how do we prevent this? And we didn't expect people to believe it.
Yeah, there's
and
always been that kind of snake oil salesman and profiteering and stuff throughout the history of medicine, that there are people that will take that spin and create something to make money. But it's never been delivered directly to the masses as quickly and massively as social media allows in this day and age.
Access to information is just anybody can get on their phone and just say something and spread it.
Well, and that's okay. I mean, that's the beauty of social media, right?
Right.
But the problem was we did not expect some of these outlandish things anybody to think about. The world is flat. No one would believe that. Well, there are lots of people that believe the world is flat. We would never have thought in, times where people were dying, their family members were dying, their brothers and sisters, husbands, wives, they were all dying of COVID. But they didn't actually believe they died of COVID.
Yeah.
Oh, they didn't die from COVID. They died from something else. That became so ingrained before we even thought, why would anyone think that? That would be illogical. But that got set in before we really understood that was where they had been. That's where they were taught. And, if you're taught something the first time, it's really hard to move out, is to learn something different. And that's for all of us, right? We do things for 20 years and we realize, oh my gosh, I got to use a beta blocker in someone who has COPD for their heart disease, and that's okay. Where in 25 years ago, we would have said, oh my gosh, you can never use a beta blocker. Yeah. But it is difficult to walk people back. And people don't want to think that I did something wrong.
Yeah.
Yes.
And then
that's true.
That's also a good thing for us. Medicine's an ever-learning field, and we're always open to learning new things, and guidelines change. So
that's true. And listeners and viewers, if we ever do anything wrong, we'll be sure to let you know. Still waiting at this point, right?
Because of course we're perfect.
That's right. Well, we're going to take this opportunity to end our episode here. Thank you for watching and being a part of our time together, and we'll see you on the next episode of Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast and you will automatically be notified when it's time for your next appointment.